Hello, everybody. Welcome to another webinar from us at Applichat. Today, we're talking about transforming employee efficiency with care coordination AI. And I'm very excited to bring you all a special guest in this field today. He is Anupam Khandelwal, and he's going to introduce himself.
So wonderful. So thanks a lot, Adam. So I'm Anupam. I'm a technologist and a product management side. I used to work for Cisco Systems prior to SageSurfer, but almost more than 10 plus years back, very close person in my family who was going through a severe behavioral health challenges, unfortunately, in his life. And that's how SageSurfer was born. And we'll talk about SageSurfer quite a bit, what SageSurfer is. But that's how it's originated. With the main reason, what did we do wrong? What we could have done differently, and that's what we do in a nutshell.
Mm. Well, yeah, when I first heard the story of the origin of SageSurfer, I was touched. It's great to see someone that's so mission focused working in this field. And also, it really struck a chord with me because since 2020, at Applichat, we've been working with healthcare providers to help them recruit and retain staff. And we know that employee efficiency is a big part of employee satisfaction. And it's important that people are connected with the right tools and making the right impacts on their patients. And today we're going to talk about it. So, in this webinar, we'll be talking about how frontline care providers are the backbone of whole person care. But whenever your frontline care team is overwhelmed, patient engagement drops and turnover rises. How do we make frontline teams actually engaged and actually equipped with all the data and access to their patients and patients' families that is necessary to improve care outcomes? So, Anupam, I'd love to just jump into it. Ask, what does care coordination look like when it's done manually? So, what sort of problem are you trying to solve at SageSurfer?
Uh, a great question. First of all, most of organization did not design a fragmented care. So it evolved with decade as different systems and processes were added to solve individual problems, right? Depending on funders' requirement, depending on internal processes. What that resulted in, care coordination integration layer became very disconnected because of these technologies and processes. So let's picture a case manager, uh, maybe in the morning, opening 5 browser tab open, one from an EHR for their progress notes and all, a different portal from primary care for different other medical needs, an eligibility check portal for checking the eligibility of the person they're managing, member managing, a spreadsheet for their caseload, a stack of sticky notes for
Mm.
who they were supposed to call back. When they refer somebody to a social service, they find out they find out if it worked by picking up the phone if they have time. If they don't have time, of course, that get backlogged. And if the patient mood or medication adherence starts slipping, nobody sees it until somebody shows up in the ER visit. So it's like so many disintegrated systems, this kind of thing happening. They spend lots significant time simply figuring out what happened yesterday before they can even determine what needs to happen today. This is unfortunate reality. They often spend more time managing information instead of engaging with people. So this is not only a staffing gap challenge, it's mostly it's also a connectivity gap. And it's very exhausting for these amazing people who are helping to provide service. When technology creates administrative burden, instead of removing it, everyone loses. It may be staff, it may be organization, it may be the member. That's exactly the challenge StageSurfer was designed to solve.
Oh, I think we've all seen the sticky notes and we've all experienced that kind of disconnected care. So I'm curious to know, like, how does it solve it? Like, how did you go about creating something that would use technology to fill these gaps?
Wonderful. So, in a nutshell, SageSurfer is AI-enabled care coordination member engagement platform that has been specifically built for behavioral health, complex care management, community-based organization, Medicaid population, and providing whole person care. Our, before I jump in further on the SageSurfer, there's one important thing which I wanted to make sure, that is our philosophy. Technology should disappear into the background so the people can focus on the people, serving them as best as they can to drive best outcome. So what SageSurfer we have done is with some only interoperable EHR behavioral health care coordination platform built to connect entire care ecosystem. That includes your providers, your patients, your families, your peer support, community health workers in one HIPAA compliant app or a solution. Instead of replacing existing EHRs, we sit alongside them with them and connect the entire care ecosystem. Four things makes it quite different. One shared view of the patient instead of five or 10 disconnected ones. Closed loop referral tracking so that nothing falls through the crack. AI powered risk stratification that flags the problem before they become crisis or seamless a crisis, and then seamless integration with provider process workflows. And our customers have reported 78% reduction in rehospitalization when using a SageSurfer platform. We have also shown or demonstrated 5 to 7x ROI on the investment for our customers.
Wow, that's huge. And that ROI, what, that's reducing costs, or like, how do they measure that?
Yeah, so it is multiple facets, right? So that comes from your reducing the cost of bringing operationalization or efficiency to the system, but also allowing them to increase revenue stream. So we open multiple different revenue streams which they may not be even tapping to. So it's a combination thereof. And most of the time we have seen much on the higher side than the lower side.
Mm-hmm. And another figure you told me was that saving around 12 hours a week across care teams. I'm just curious because we work with a lot of, healthcare employers, and they're always looking to optimize their employee experience. What parts of the day disappear first whenever integrate a platform like yours?
Gotcha. So I think let me take it let me explain it from where we help out, right? In saving more than 12 hours per week. So the biggest saving don't come from one feature, right? They come from eliminating dozens of interruptions throughout the day of a frontline staff. So it could be from a documentation going first. So EHR means stop entering the same information multiple systems. We have seen in some of our deployments, they are 3 or 4 times they're entering the same information. The next is the phone tag which they play, chasing the referral status. Is the person actually made it to the referral or not? Because the closed loop tracking, which we can do it automatically, right, through the system.
Mm-hmm.
Then they are spent hours assembling quality reports for payers or their funders by hand. In our particular case, this is just a live dashboard now available, right, at their fingertips, which they can download whenever it makes sense. And then finally, staff stop manually reviewing every chart to figure out who needs an outreach today. That's a risk flag, tells them. So it's bringing all the different capabilities together and making sure that the data is converted that into right insights so that they can take proper action. So organizations routinely recover more than 12 hours, like what Adam talked about, per coordinator every week, because the staff is spending less time searching, documenting, coordinating logistics, and more time in supporting members or clients.
Mm-hmm. Okay, I think you touched upon it, a few of the things that it does. What are the tasks that users value the most that you've, I mean, they're grateful, most grateful that you've taken out of their hands?
So I think I think there are multiple tasks, but let me provide some high level ideas, right? Or so one is appointment reminders. How do you do best no show follow ups? Referral tracking from start to finish, standardized screening, which could be done offline from PHQ9, GAT7, SDOH, prepare statements, and others, auto scored, and but not only scored, but routed to the right person, and then real time alerts when a care plan lapses or score changes. All of that feeds into one dashboard instead of multiple different spreadsheets now. SageSurfer doesn't, one important thing which I wanted to make sure, SageSurfer doesn't
It looks
automate
like
clinical
oh,
judgment. It automates administrative work surrounding clinical judgment that allows staff to practice at the top of their license or their work without while reducing burnout.
okay. Because I mean, we might have cut out there, but I think we got the gist of it. That's one of the things about AI, isn't it? This is in our title, transforming employee efficiency with care coordination. AI, AI is often misused and it distracts people from the important work, but it sounds like you're able to leverage it to allow people to focus on practicing at the top of their expertise and their license.
That is correct. That is correct. If it is used to augment their current work, provide them the right insight, not just the data, that can be a game changer if it's done well.
Mhm.
And that's
Yeah.
what we are trying to make sure that we are becoming an amplifier in their care delivery workflow.
Okay. I like that word, amplifier. If anybody has a question you want to ask us, feel free to put it in the LinkedIn or YouTube chat. Keeping an eye on those. But really back to decision making. I know in behavioral health, lived experience is important, and we kind of have this balance between your platform using assembled data and AI insights in against what people have seen in their day-to-day lives, which is more of a human experience. So how do you give someone decision-making support without overriding what they already know from lived experience?
This is one of the principles we care most about. This is important to get it right, I think, for everybody. What SageSurfer does is SageSurfer surfaces signals. Let's assume a mood score trending down, a missed check-in. It never tells a peer supporter what to do about it. We bank on their relation and the live experience are still there. We're just making sure that they are not operating blind now, right? Think of it as removing the guesswork about whether something changed. So that judgment about how to respond stays exactly where it belongs, and that's with them. SageSurfer is simply augmenting their
I have frozen
expertise.
there again.
Okay, let me again say. So think of it as removing the guesswork about whether something changed. So their judgment about how to respond exactly where it belongs, and it's with them. SageSurfer is simply augmenting their expertise. The platform surfaces relevant
I have
information.
broken up there a bit again.
Okay. The platform surfaces relevant information,
Mhm.
highlights potential risk, recommend next steps, ensures nothing falls through the crack. The humans still decide what's next, what happens next.
Mm.
Think of it like a GPS. GPS recommends a route, driver remains in the control. So they're still in the control. We're just helping them to amplify what they do
Mm.
effectively.
Okay. That's funny because I was on a 5-hour drive a couple of days ago, and I there was a winding road, and one thing I found very useful about the GPS was that it lets you see what's beyond your line of sight, and you can see when the next curve's going and when it's safe to overtake, and maybe it's safe not to, or safer not to. And I really like that analogy where sometimes it takes you down a short, but you know in your intuition that it's actually going to be longer. But overall, generally, it's good to helpful to follow what it says. I really love that analogy. So if you look at, I think you mentioned that okay, community health workers are users of your platform. What are some of the things that they can do that they couldn't do before? Because a lot of our audience are interested in providing rural healthcare. And I know through the Rural Health Transformation Program and a few other initiatives, community health workers are becoming a more important and prominent part of the workforce. So really keen to hear how they can be augmented with this technology.
Community health worker are integral part, right? For the care delivery. Now, with the SageSurfer, they can get a real-time caseload view instead of just the binders to work on, right? They can message the whole care team. That includes both the clinical and the non-clinical, including family in one particular thread. They can
Mm-hmm.
log an encounter and have it visible to clinician instantly without even having any EHR credentials. And they can get automatic nudge the moment something changes somewhere, someone on their list, instead of finding out 3 weeks later, maybe an ED visits happen or something else happens, which is relevant, right, for them. So rather than they work independently, they now become integrated part of the multidisciplinary care team. That improves both their confidence as well as drive better outcomes for that
Mm-hmm.
member.
Oh, okay. On integrated care team, and I know you've mentioned to me before the term care circle.
Yep.
Kind of new words for me, to be honest. And I know for many people, with so many new tools coming out that use AI, it's a bit hard to keep on top of all the different terminologies. So, could you tell us what is a care circle and how does that get built in SageSurfer, and what does its benefit to the patients or the clients?
Yeah. So if when we look at whole person care for an individual, mostly multiple different organizations are involved, right? Depending
Mhm.
on their medical, behavioral, dental, social drivers of health, and other needs of that individual. So it requires a whole ecosystem. A care circle brings together every supporting member around that member. So,
Okay.
for example, let me walk through, right? How does that get built and what does a typical care circle may look like? Uh, it could be done at the intake level, all right? A case manager sets up a member profile, right? So we pull the data from an EHR or sets up a member profile, and the member together in partnership with your case manager or a care coordinator invites the people who matters. Those could be default added. So it could be clinical people as well. So your psychiatrists, your therapists, your PCP and other providers. But it could also include non-clinical providers as well, right? So like your peer support, your CHWs, your social service providers, and everyone. So
Mhm.
that's very, very important. And everyone gets a role-based access or a shared personal support team view, right? But all their access is dependent on what makes sense for them. And it's connected to the clinical record, right, from the EHR integration perspective. Everybody knows based on their responsibilities, what needs to happen, their current priority, open tasks. So we are trying to bring all these disconnected conversations that everybody can collaborate through a shared care experience. So a member, for example, I don't have to repeat my story again. Everybody has the information, what they need in order to best support that member.
Mm. It's so valuable, but it's whenever it's across different providers as well.
Yep.
I'm
Yep. You're
from
absolutely correct. Because they
yeah,
may be on different systems at all, totally, all right? They may have different systems which don't talk to each other. But if you
yeah.
can get the right information quickly in more real-time manner, you can act on it more proactively as well.
Mhm. Yeah, I'm from the UK, and we obviously have a national health system, so they do share all your notes in between each other. But whenever I got to the US and I had a health issue, I had to go to multiple people and just to say the same thing over and over again. It's
Yeah.
kind of
Like here.
difficult for a lot of patients as well, particularly if it's like mental health, behavioral health. it's better for that, sometimes to be said in the right context and then shared between the right people. So I know that family and friends are a big part of this too. How do you bring them in? Where consent rules apply, how do you navigate those?
Great question. I think the linchpin of everything is for us is what we strongly believe is trust is foundational. So consent management is built directly into the SageSurfer platform, right? And it's very granular and member controlled. A family
Yeah.
member might see an appointment reminder, a general wellness updates by default, but not clinical notes, unless
Yeah.
the unless the member or a patient explicitly authorizes it. Authorizations can be changed or revoked anytime. Rollbacks permissions defines or determines the visibility. Organization maintains HIPAA compliance while enabling meaningful collaboration. So bringing more people in the circle never means giving up control over what they see. It's a
Mm.
collaborative care with appropriate safeguards already inbuilt into it to make that happen. We want to make sure only information flows to the right people at the right time so they can take the right action.
And what can, say it's like mother or father, what can they see about the patient?
So a mother, for example, right? So like being a caregiver, she can see the appointment reminders, right, related to that particular individual. She can see some general wellness data which is going on related to the person as such, how that person is performing on the goals, if that is allowed per se, and multiple others, depending on how it's being controlled and how that accesses. They may not see the clinical notes, right, which based on the clinical visit the member had with the clinician,
Okay.
unless it's explicitly being authorized, right, and shared.
Yeah. And how does that help employees? Suppose would be a follow-up question. All the people that need to see this and have access. How does that improve employee efficiency?
So I think it's an important thing, right? So one important thing is by itself disjointed pieces. What we are trying to make sure is let's take an example, right? So just
Hmm.
to talk you about the early warning and how it can really help is, let's assume a member mood score dropped, right, over
Hmm.
two virtual check-ins. They also missed the last appointment as well. They are also falling behind their care plan activities. The
Hmm.
combination of multiple different things can trigger a real-time alert to
Okay.
relevant stakeholders. That may include your case manager or a clinician. It's not a monthly report. It's not like at the end of the month you're trying to see it, what exactly happened on a chart review. But it is trying to make sure that as the things transpire, based on the threshold and the rules which are configured, it get escalated up. So team can reach out not on the multiple days later, but they can reach out in the afternoon instead of maybe 3 weeks later for the ED visit if that happens. So now we are moving from a reactive to more proactive,
Mm.
trying to make sure that the person's needs are addressed as quickly as possible so we can drive better outcomes.
Okay. And I know that being proactive is often about seeing the early warning signs too, and
Yep.
keeping on top of those. How, like, what does that look like? What would an alert for that look like in practice, and
Yeah.
what triggers it?
As I just talked about, right? So it could be a combination thereof. So it's not about creating a noise or a data by itself. It's a combination of different things in the contextual of that individual, which is very, very important. So that it may be like I talked about earlier, it could be a virtual check-in where person did not answer the mood or the mood score went down. It could be the care plan struggle, maybe person not taking medication together, maybe struggling to make some appointments on time, which was not the case in the past.
Mm.
All that combination thereof can become an early warning signal. And it's very personalized, right? And that based on that, it can trigger relevant workflows, right? To whom to inform, what to inform, what information, and various other things, and what to do with that. And that's
Hmm.
where our 150 plus business flow or workflows which comes into picture in order to drive the right level of engagement and closure on that particular alert or a warning.
Yeah. So with those 150 flows, and this is a topic that everyone's discussing at the moment. What does the future of work look like, particularly with AI coming in and augmenting or replacing? What do you think the jobs of the future in behavioral health look like now that platform like SageSurfers are out there that really augment that human work?
Yeah. So I want to take it to my earlier statement. We are not replacing anybody at all, right? So what we are trying to is we are trying to amplify what work they can do, right?
Mm,
So, like for example, if a case manager has the right information available at their fingertips, instead of searching through piles of different data system or other systems and all, in order to get that information and
mm-hmm.
take and then guide them what to do or inform the appropriate parties and automate that process, that allows them to spend more time with the member and build that trust. Healthcare is all about trust, right? So in order to make sure that that the people can work in a more collaborative fashion, right? That's very, very important. So what again, it's AI and other capabilities. What we are trying to do is we are trying to make sure that the information is available seamlessly,
Mm,
real time, so that they can take action as quickly as possible and meet the person where they are in their care journey.
yeah, I love that. I know the care coordination is a big part of the rural health transformation program at the moment, and curious to know if there's any maybe scope in rural health transformation program or other grants to use SageSurfer and well, to apply and get funded to use SageSurfer. Are you seeing any opportunities out there for particularly rural organizations?
I think they're several, right? And I think one you alluded to, Adam, right? Uh, there are multiple paths, right? The first happens to be the rural health transformation program. As everybody may know, it's a 50 billion federal fund rolling out to states through 2030. And technology innovation is one of the CMS approved use category. CMS has defined eligible IT infrastructure broadly to include referral, care coordination platform like ours. The catch is the state defines their own RST plan, so you need to work with them based on the eligibility and the prioritization what they have,
Mm.
right? That's one. The second is the CCBSC, Certified Community Behavioral Health, which currently has two different grants currently open. One is a Planning and Development Implementation Grant, which is due on August 17th, no for being 2614. And then you have your Improvement and Advancement Grant, which is also due on August 17th, which is more for the people who have already applied for planning and others and trying to take it to the next level. That is one part of it. Then you have HRSA grants and others for FQHCs, for example, Federally Qualified Health Center. There are
Mhm.
multiple initiatives which are focused on integrated behavioral health. So care coordination is a linchpin. If
Yeah.
you cannot make sure that you don't have the right information available at the right time for you to take action, things fall through the crack. So
Mm.
as a result, there are multiple different initiatives uh, which are there across, and plus the foundation as well, right? There are various different foundation, local and
Yeah.
state level, are also pushing for how you make sure you connect the dots. Well,
Yeah, this is one of those things that align with government policy, isn't it? To
yep.
introduce technology and reduce waste in healthcare. So certainly the time I think to act is now. Could you tell us just as we close, and I invite anyone to ask any questions again in the chat if you're keen to learn more. Who does your company CSRF work with, and how can listeners hear more about you?
Yeah. So we work with community mental health centers, SUD treatment centers. We started with the
Okay.
county system, county behavioral health system. health systems, IDNs, FQHCs, CCBHC networks, and we are also in active discussions with health plans and ACOs. Our implementation approach is very collaborative. We configure workflows around each organization care model rather than forcing organizations to change how they deliver it. And if it's resonated, easiest next step would be a 20-minute
Maybe the
readiness call,
connection
and
is
we can
frozen a
be
little
happy
bit.
to. Sorry,
Please hold
sorry.
tight.
Yeah. So I was just saying, if this resonated, the easiest next step is 20-minute readiness call. You can reach us at SageSurfer.com or info at
I'll just take
SageSurfer.com.
over. I think Anupam's connection might have hit an issue. I will stop speaking if he is able to.
Can you hear me?
Hello?
Can you hear me? Can you hear me?
Had a connection blip there. We both
My,
cut.
my,
Um,
my apologies.
yeah. Do you want to just pick up? You were talking about CC, BHCs, and the eligible, clients that you work with.
Yeah. So let me just repeat it again. I don't know
Okay.
where we lost. So we work with community mental health centers, SUD treatment centers, county behavioral health systems, IDNs, FQHCs, CCBHC networks, and we are also in active conversation with health plans and ACOs. Our implementation approach is very collaborative. We configure workflows around each organization's care model rather than forcing organizations to change how they deliver. And if this resonated, the easiest next step is 20-minute readiness call, and you can reach us at sagesurfer.com or info at sagesurfer.com.
Nice. Yeah, and I will put that link below this video for anyone who's watching the video too. Thanks very much for really
One last
important.
thing which I wanted to add, just for as a last thing now, as a closer, SageSurfer empowers your frontline teams to break the burnout cycle and deliver truly connected care. And if this resonated, as I said earlier, please reach out. We'll be happy to provide you more details and spend your time as such and provide you what are the different grant opportunities which you can apply for to pursue the opportunity like this.
Awesome. Thank you so much. Really important topic. Yeah, it was great to hear, some of the new technologies and new initiatives that are coming out to make care better and coordinate things, particularly with AI. So I'll certainly be looking SageSurfer up and seeing if there's any opportunities for my clients. And for all you listeners, feel free to reach out to either of us if you want to learn more. And thanks for joining. Thanks, Anupam.
Thanks a lot. Thank you.
Bye.
Thanks a lot, Adam. Thanks, everybody. Thanks. Bye.